Challenges in the field of healthcare have been a hot topic over the past few years. One complaint we often hear about is the long wait times at emergency departments. WITN looked into the root of the issue and how it impacts us here in the East. Courtney Bunting has more on what we found out.
No one visits an emergency department on a good day, but it's a necessity for a lot of people. Unfortunately, what can already be an unpleasant trip can turn much worse when you factor in the many hours some are spending in waiting rooms. That problem has only gotten worse recently. Our investigative team dove into these numbers to see why they're so high and what can be done about it. When you're waiting for an available hospital bed, time is often not on your side. As Thurman Hoggard quickly found out, it can easily turn into an excruciating wait.
You at the mercy of the hospital, because if something happens, you could die right there in the chair.
Hoggard fell off a ladder while putting up Christmas lights outside his Windsor home in November. He hurt his neck, and after multiple tests indicating nothing was wrong, he was still in severe pain. That's what brought him to ECU Health's Greenville Emergency Department, where he waited for more than 16 hours before a doctor came to assist.
The hospital should be ashamed of what they did.
His brother, Herman, is his medical power of attorney.
You look back and see what happened to him and see that it's probably happening to people every single day that go into these big emergency rooms.
He's right. Their story, while unpleasant, is unsurprising for many, but it's a hard one to point fingers at when you consider the stress nearly every hospital in the country is under. Take a look at these numbers from CMS.gov. That's the Centers for Medicare and Medicaid Services. They keep track of wait times at ERs across the country. These wait times you're seeing apply specifically to emergency department patients who are not admitted or outpatients. You can see ECU Health's Greenville location's average is 4 hours and 45 minutes. Even higher, Onslow Memorial has a wait time of 5 hours and 12 minutes. The state average is 3 hours and 12 minutes. If a patient needs care immediately, let's say, for example, they arrive by ambulance, they'll likely be seen right away. The rest are evaluated based on their condition.
You come in you're triaged first by a nurse. There's a physician in with the triage nurse triaging, doing a secondary work on every patient. And we have started pushing diagnostic tests, laboratory tests, even radiology tests out to the lobby.
For those who have to wait, ECU Health Chief Operating Officer Brian Floyd says they're facing demand like never before.
Our emergency department, our hospital is full. We have over 1,000 patients a day, which is a record for this hospital in its history.
And it's not just a matter of more people needing care. As Dr. Lee Patterson, ECU Health's Chief of Emergency Services, explains, their needs are more serious in part because of COVID-19.
They are sicker coming to the ED than they were certainly before the pandemic. The chronic conditions are much further advanced. The diabetes is further advanced, the STEMIs, the strokes.
Add to that the fact that hospital staff are leaving in droves, with the Forbes survey showing 47% of U.S. healthcare workers planning to leave their current role by 2025.
I think there's a need for more staff everywhere in healthcare.
The specifics of that need, though, weren't provided. When asked for numbers, ECU Health officials only said that all beds in the emergency department are fully staffed and operational. So what's the solution? It's of course not a simple answer, but Floyd feels it starts with expanding access.
Sometimes care backs up in emergency departments because it wasn't already rendered earlier when the need wasn't as great. And so that's why we're proponents of things like Medicaid expansion, because it allows people in poor communities to have access to a way to get that health care that they need.
It seems a bit contradictory, though, when you factor in the 5 locations ECU Health plans to close, most of which serve rural areas due to a loss of $46 million. ECU Health said that while it's optimistic Medicaid expansion or other helpful programs may happen later this year, it has to act now with difficult decisions to keep its operations optimized. Officials wouldn't say outright, though, if Medicaid expansion would have prevented the closure of these facilities. Unfortunately, there doesn't seem to be an immediate solution, which leaves vulnerable patients in a difficult position.
They all took an oath to take care and not do harm, and unfortunately, I think sometimes they are still doing harm.
Another layer of this is the fact that people often come to the emergency department because it's their only means of getting care. And while that's something healthcare professionals say they understand, they also ask everyone to be mindful of whether their issue is an emergency or something that can be addressed at an urgent care facility or during an appointment.
WITN Investigates is committed to covering the stories that matter most to you. If you have something you would like us to look into, email us at WITNinvestigates@WITN.com.